Governor Pawlenty, we'll start with you. You, as every other participant here tonight, will notice that former Massachusetts Governor Mitt Romney is not here, but you've had plenty to say about Romney Care, including this, quote, "Looking at the Massachusetts experience, it would not be the one I would want for the country to follow any further." A poll just weeks ago showed that 84% of Massachusetts residents are satisfied with the plan. Why isn't that good enough for you?
Well, Governor Romney's not here to defend himself, and so I'm not going to pick on him or the position that he took in Massachusetts, but I will tell you this. The answer to our health care problem is not to drag it into Washington, D.C. and create a top-down, government-run, centralized, limited choice, limited option system. We took a different direction in my state of Minnesota. I governed there. The direction for health care reform is to empower individuals and families to make choices that are best for them. And if they need financial help, let's give it to them, but let's give it to them directly. And this is an issue. President Obama stood in Iowa in 2008 on the night of the Iowa caucuses, and he promised the nation that he would do health care reform focused on cost containment. He opposed an individual mandate, and he said he was going to do it with Republicans. He broke that promise. He went to Washington, D.C. and jammed down our throats one of the most partisan, most misguided pieces of legislation in the modern history of the country. It's going to make health care costs worse, not better.
Thank you, Governor. Senator Santorum, I turn to you. Governor Johnson has said that in addition to repealing the president's health care plan, he thinks Republicans need to think about repealing the prescription drug plan tied to Medicare. You voted for it. It's cost hundreds of billions of dollars. You've said you regretted that vote now. As president, would you work to repeal that and leave the 25 million plus seniors who now enjoy that benefit without it?
No, what I would do is work to reform the entire Medicare system, which is what's being proposed by Paul Ryan and what I've been proposing for a very long time. One of the reasons I actually voted for the Medicare prescription drug plan was because it was a private sector operated plan. It was not, as the current Medicare system is and what Obamacare is, a government-run, top-down type of approach. And in fact, the way we designed that program resulted in the program coming in 40% under budget. I don't know of any other program that's actually come in under budget in Washington, D.C. And the reason it was is because the design was right. We need to take that design and apply it to the entire Medicare program, which is exactly what Paul Ryan has proposed. So the answer is not to pull prescription drugs out. Prescription drugs is an important part of health care delivery in America, and to have a Medicare plan without a prescription drug component really doesn't make any sense. We need to have a plan that is run efficiently, that is private sector, and is not an unlimited entitlement. What we have right now is an uncapped entitlement. We need to cap the entitlement and put people in charge instead of the government.
Congressman Paul, you have said that medical malpractice awards are creating a crisis in the medical industry, driving doctors out of the business. We also know the CBO has projected that tort reform could save the federal government $54 billion over 10 years. So why are you against federal tort reform?
Because the federal government shouldn't be involved. It's a state matter. Tort law is a state matter. And it's a tough vote for me because as a physician, I know doctors are on the receiving end, and it does push up, the cost of medicine. But if you look carefully at all my legislation, I have offered a free market alternative to this, to allow the doctors to negotiate, to make contracts, get them out from under the monopoly control laws, give tax deductions for insurance policy where there's no fault insurance. And there is a way in the private market today. We can't contract with our patients for a third-party third-party settlement, and that takes it out of the market, turns it over to the attorneys. If they accept my position on this, a free market approach, and not a nationalized tort law control of this, believe me, we'd put all the trial lawyers out of business, and they wouldn't get most of the money that comes from all these lawsuits when they're suing doctors.
Thank you, Congressman.